2 o'clock in the morning. You finally work up the courage to peek underneath your bandage. And now you're wondering, is this normal or is my surgical site infected? First, take a deep breath. As a registered nurse with over 25 years of healthcare experience, I can tell you that this is one of the most common questions that patients ask after surgery. The good news is that some redness, swelling, bruising, and discomfort are perfectly normal after surgery. The challenge is knowing when those normal healing changes cross the line into something that needs prompt medical attention. Today, I'm going to walk you through the 7 signs of a surgical site infection that you should never ignore, explain what's considered normal after surgery, and help you know exactly when it's time to call your healthcare team. Let's get started. Sign number 1, the redness is spreading. When you first look at your incision, a thin line of pink or mild redness right along the incision is often part of normal healing. That's your body's inflammatory response doing exactly what it should. What concerns us is redness that starts spreading further away from the incision, gets brighter, becomes more intense, or keeps getting worse instead of gradually improving. Here's a little trick that many nurses use. Take a clean pen and lightly mark the edges of the redness. Tomorrow, compare it. If the redness has spread well beyond that line, it's time to call your surgeon. Sign number 2, thick drainage or a bad smell. A small amount of clear, watery, or light pink drainage during the first few days after surgery can be completely normal. We often call this serosanguinous drainage, and it's often a normal part of healing. What isn't normal is thick yellow, green, or cloudy, or foul-smelling drainage. Those are possible signs that bacteria is growing inside the incision and your physician needs to evaluate it. Sign 3, the incision starts opening. This is one you should never ignore. If the edges of your incision begin separating, if your stitches or staples no longer seem to be holding the edges together, or if you notice the wound opening, contact your surgeon promptly. Even if there isn't an infection yet, an opening incision needs professional evaluation in order to prevent one. While we're talking about looking at your incision, remember this. Unless your surgeon specifically instructed you to remove the dressing, don't keep taking it off just to look at the wound. Every time we expose an incision unnecessarily, we open the door for bacteria to enter. Follow your discharge instructions carefully. Sign number 4, your pain is getting worse. Pain after surgery is expected, but here's what should happen. Each day, little by little, your pain should slowly improve. If instead, your pain suddenly becomes much worse after it had been improving, or it's dramatically more painful than before, then that deserves a phone call to your healthcare team. Sign 5, increasing warmth and swelling. Some swelling is normal. Some warmth is normal. Healing creates inflammation. The important thing is the direction. Healing should gradually improve. If the swelling keeps increasing, or if your incision becomes noticeably hotter than the surrounding skin, your immune system may be fighting an infection underneath. Sign 6, fever or chills. Your body gives us clues that extend beyond the incision itself. If you develop chills, body aches, or a fever, especially one at or above the temperature that your surgeon told you to report, it is important to contact your healthcare team. Different surgeons may use different temperature thresholds, so it's important to follow your discharge instructions. If you're unsure, call and ask. People with diabetes, those who smoke, or anyone taking medications that may suppress the immune system may have a higher risk of developing a surgical site infection. That doesn't mean you will develop one. It simply means it's even more important to monitor your incision closely. Sign 7. You just don't feel right. This last warning sign isn't something that you'll find on a checklist, but after decades in healthcare, it's one I've learned to never ignore. Sometimes patients simply tell us, "I don't know how to explain it. I just don't feel right." Maybe you're suddenly exhausted. Maybe you're weak. Maybe you feel lightheaded or nauseated. Maybe something just feels different and you can't explain it. I've learned over the years that patients often recognize subtle changes before those changes become obvious. Trust your instincts. If something feels wrong, call your healthcare team. Here's what I want you to remember. Having one of these warning signs does not automatically mean that your incision is infected. Many people experience perfectly normal changes that resolve on their own while healing. There's absolutely nothing wrong with educating yourself online. In fact, that's probably how you found this video. But Google, YouTube, and social media can never replace someone actually examining your incision in person. If you're worried, call the surgeon or healthcare provider who performed your surgery. I promise you, they would much rather answer an early phone call than have you wait until a small problem becomes a much bigger one. And if you develop rapidly spreading redness, difficulty breathing, confusion, uncontrolled bleeding, or any other medical emergency, don't wait for the office to open. Seek emergency care immediately. If this video helped answer one of the questions you were already searching for, I'd love to have you join my community by subscribing. Here on The Nurse Next Door, I answer real medical questions that patients ask every single day with straightforward, evidence-based answers that you can understand. Thank you so much for spending a few minutes with me today. If you or someone you love has a hospital stay coming up, you can find my free hospital packing checklist in the link below. Take care of yourself. Heal well. And remember, sometimes the best answer you can have isn't from another internet search. It can come from the nurse next door. I'll see you in the next video.